Small lesions that are sometimes found on mammogram that you're not able to even feel yet, or your doctor can't even feel yet. And you can see that on mammogram. And that's when cancers are found early, before they're even palpable. And that's when they're more treatable. If you find cancer in early stages in the breast, like stage 1, the cure rate is, almost 100%. If it's a stage 2 or stage 3, the cure rate goes down. So we want to find these cancers as early as possible so that we can cure these breast cancers in these women. So the American Cancer Society and I still agree with these recommendations that women should have it yearly starting at age 40 and until they're not able to do it. Because the older we get, the more likely we are to get a breast cancer. And so I think it's extremely important for even older women to consider going and getting their yearly mammogram done. The digital mammography, I think, is a lot clearer picture. They're able to actually manipulate the images so that they can make the background lighter and darker. And so especially in women with very dense breasts, I think digital mammography is the way to go. Studies have shown that it will pick up more breast cancers in dense breast in younger women, premenopausal women, less than 50, than regular mammography. So I think in most women that's the best modality to use for your baseline, for your screening mammograms that are done yearly. Sometimes we will add ultrasound if we can't see something clearly on that mammo, or if that breast is very dense. And sometimes we'll even add an MRI if there's a question of a lesion there that we're not able to see clearly enough. Because there's no study that's 100%, but the digital mammograms have gotten very, very good. It's still a little uncomfortable, and especially if women are having breast pain already. But I think that little bit of discomfort for only a few minutes is certainly worth the benefit that you get from doing a screening mammogram. And so I would still encourage women to do that. If they have tender breasts before they have the mammogram done, then I would suggest maybe taking an over-the-counter anti-inflammatory or some Tylenol before they go. And that way when they squeeze the breast and do the exam, it's not as uncomfortable for them. The American Cancer Society has come out and said, the self-breast exam now is kind of optional. And the reason for that is because some studies showed that we really weren't very good at picking up lumps in our own breast. But I still have women that come in and they found a lump in their breast, or they feel something new or something different. And if they hadn't been examining themselves, they would not have felt that lump. And it may be a year before they see a doctor. So I've seen women they sometimes find their own breast cancers, and I still encourage my patients to once a month at least do an exam in the shower and feel of their breast and get familiar with them. And if they see a change, even if it's a change in the color of the breast, a pinkness, or any kind of sore on the breast, or anything that's changed, those are worth letting the doctor know what's going on. Typically, if you find something new and it hasn't been there before, it's a change, I would suggest that you call your doctor and at least let them know. They may recommend that you wait a month, check it again, see if it's there, but they may want to see you and to actually feel of it themselves to see if it's something significant. So I encourage them to at least let their doctor know they felt something new in their breast. Be aware that breast cancer is very, very prominent. 1 in 8 women get it in their lifetime. And we need to have more education about it, and women be aware that this is something that happens, and because a lot of women think it's not going to happen to them. And they will ignore symptoms and not come in until things have gotten a lot more progressive. So I would suggest that they report changes to their doctor and not wait. And also be sure they get that yearly mammogram starting at age 40. Younger, if they have a family history, they should discuss that with their doctor. If they've got a family history of breast or ovarian cancer, they may need to start their mammograms earlier, or some other type of screening like ultrasound. So I just think it's very important that they do. If they wait 4 or 5 years to get a mammogram, sometimes that cancer has gotten more advanced, and it makes it more difficult to treat.